Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we considered the first cluster B or dramatic or erratic disorder, namely antisocial personality disorder in detail. In this episode, we will consider the second of the four cluster B or dramatic or erratic disorders, namely borderline personality disorder or BPD. Borderline personality disorder belong to the cluster B personality disorders, namely the dramatic or erratic disorders, which involve affected persons displaying inconsistent or predictable thinking, intense theatrical or unstable emotions, and impulsive, melodramatic, or thoughtless behaviors. Mental health professionals officially recognized borderline personality disorder in 1980. It was named borderline personality disorder because it seemed to occur on the borderline between neurosis and psychosis. It involves an emotional dysregulation that makes you swing between neurosis and psychosis. As a result, the affected persons would experience an intense emotions or lack of them. Similarly, they may have difficulties with self-image and self-identity, and their sense of self may change from one day to another or even from one moment to another. Hence, swinging emotional states and unstable sense of self can make their behavior dramatic and erratic, causing frequent changes in job, relationships, personal values, and goals. Thus, borderline personality disorder is a mental health condition characterized by a long-term and consistent pattern of difficulty with emotional regulation that results in low self-esteem, mood swings, and impulsive behaviors, causing chaotic interpersonal relationships. When you are affected by borderline personality disorder, you are not stable in the way you perceive yourself and the world around. You always view reality in extremes and as black or white, that is, as all good or as all bad. You have an intense fear of abandonment as you feel that you lacked a certain level of nurturing while growing up. Hence, you constantly seek a high level of caretaking from others as adults. To achieve this care, you may manipulate, flatter, or please others. However, not getting the care you look for can leave you empty, angry, and abandoned, leading to mood swings, unstable emotional states, and desperate and impulsive behavior. You may find it difficult to maintain a balanced or neutral emotional state and a stable sense of self so as to behave in a composed, sensible, and stable manner. As a result, borderline personality disorder is a chronic mental health condition that can disrupt family and work life, interpersonal relationships, and long-term life planning. It can also lead the affected persons to take recourse to self-injurious behaviors such as cutting oneself, self-harming, reckless driving, promiscuous sex, and committing suicide. Impairment from borderline personality disorder can lead to suicide risk among young adults, though it tends to decrease with age. People suffering from borderline personality disorder don't know they have it and may not realize that there is a healthier way to behave and relate to others. Symptoms of borderline personality disorder are the following: having powerful emotions that changes quickly and often, having episodes of anxiety and depression, tendency for self-harming, self-mutilation or injury, or recurrent suicidal behavior, tendency for risky and dangerous behavior such as promiscuous sex, reckless driving, gambling, overspending, drug or alcohol abuse, and the like, being inappropriately hostile and manifesting antagonistic behavior, having intense fear of being abandoned, rejected, and being alone, having distortions in thought, unstable sense of self, and fragile self-image, leading to constant changes in the long-term goals, career plans, jobs, friendships, family and marriage relationships, identity and values, getting caught up in chronic and persistent feelings of emptiness, being bored, being unfulfilled, worthlessness, sadness, and self-loathing, having transient and stress-related paranoid thinking and dissociation, leading to losing touch with reality, and experiencing bouts of intense anger, difficulty controlling it, and expressing it with biting sarcasm, bitter words, and angry outbursts. Symptoms of borderline personality disorder usually appear in the late teen years or early adulthood and become worse during mid and late adulthood. Troubling events and stressful situations can trigger the symptoms and make them worse. However, as the person grows in age, the symptoms seem to decrease. Severity, frequency, and duration of the symptoms are unique to each individual and so varies from person to person depending on the specific condition of the individual. Borderline personality disorder is relatively rare and it affects approximately 2% of adults and is more common in women than in men, with 75% of cases diagnosed occurring among women. Nearly 20% of psychiatric hospitalizations are people affected by borderline personality disorder. Of the outpatients receiving treatment in psychiatric hospitals, 10% have borderline personality disorder. About 8% to 10% adults with this disorder commit suicide. And the risk of suicide in people with borderline personality disorder is 40 times that of the general population. Research shows that there is no specific condition or cause that leads to the emergence and development of borderline personality disorder. However, it is caused by a combination of factors. Firstly, shared genetic factors among family members can lead to the transmission of this disorder from members of the earlier generation to the members of the later generation. Secondly, malfunctioning of parts of brain that control emotion and behavior and abnormal levels of certain neurochemicals in the brain that affect the quality of person's emotional life can cause borderline personality disorder. Thirdly, environmental, cultural, and social factors such as physical, emotional, or sexual abuse, abandonment, conflicts, unstable or invalidating relationships, and other traumatic experiences during childhood, maternal separation, poor maternal attachment, inappropriate family boundaries, and parental substance abuse also can contribute to the emergence of borderline personality disorder. Unfortunately, there is no way to prevent borderline personality disorder as it is genetically inherited, determined by malfunctioning of the brain, and conditioned by the environmental, cultural, and social atmosphere in which a person is brought up. However, early detection and timely treatment and the tendency of the borderline personality disorder symptoms to gradually decrease with age can help people with this disorder to manage the symptoms and improve their quality of life. However, without diagnosis and treatment, the long-term outlook or prognosis for people with borderline personality disorder have increased risk of being affected by substance abuse, depression, self-harm, and suicide. Besides, they can experience unstable and chaotic relationships, rocky friendships, have trouble keeping a job, have increased risk of divorce or estrangement from family members, and face legal and financial problems. Diagnosis of borderline personality disorder is done by a licensed mental health professional such as a psychiatrist, a psychologist, or a clinical social worker after a thorough and careful medical exam to rule out other possible causes of symptoms. Diagnosis calls for a comprehensive psychological evaluation of the affected person's symptoms, experiences, and family medical history so as to determine if the person suffers from borderline personality disorder, the severity of the symptoms, and to prepare a treatment plan specific to the concerned person. Treatment includes medication, therapy, or both. The benefits of mental health medications for treating borderline personality disorder are unclear, and so they are not used as the main treatment for the illness, but used to treat specific symptoms or mental conditions such as mood swings, anxiety, or depression that co-occur with a borderline personality disorder. Any therapy that helps the affected persons to be aware of their present situation and emotional state, to manage their intense emotions, to reduce mood swings and anxiety, to prevent self-destructive and suicidal behaviors, and to improve relationships can be used as part of the treatment process. Thus, by managing the conditions accompanying the borderline personality disorder with medication, learning to deal with the symptoms of the disorder through therapy, taking advantage of the decrease of severity of the symptoms with the age, focusing on the proper management of current living rather than focusing on long-term cure, and with the support of all who care for you, you can deal with the impact of borderline personality disorder reasonably well. In the next episode, we will take up for consideration the third dramatic or erratic personality disorder, namely the histrionic personality disorder, in detail. Thank you for watching this video. Stay blessed until we see you again with another video.